Hello, folks. This is Sevtap Savaş, and this is our conversation. So in today's episode, I thought we could summarize the important information we have discussed in the previous recordings, starting with the fact that cancer is a very common disease, and it affects all sexes, genders, and age groups. So, and it's the number one cause of death in Canada, even surpassing the deaths caused by heart disease. So what are the numbers in Canada? We have seen that around 43% of Canadians are diagnosed with cancer or expected to be diagnosed with cancer. So this translates roughly into 2 in 5 Canadians. And in terms of deaths, 25% of the Canadians are estimated to die because of cancer. So in a family with 4 individuals, that would mean one of them by probability is expected to die by cancer. So this is the extent of how common this disease is and how impactful it is on our population in Canada and elsewhere. So when we specifically look at the numbers in Newfoundland and Labrador, we have seen that every year around 4,000 residents of our province are expected to be diagnosed with cancer. 4,000 every year. And in terms of mortality, unfortunately, around 1,600 Newfoundlanders and Labradorians are expected to die because of cancer. This is every year, 1,600 individuals. So these are significant numbers. I'm pretty sure we all know someone who has been diagnosed, went through or survived cancer, or someone who was lost to cancer. So, so I think it's there, it's now reality. But what we are going to do with this information is what really matters to me right now. So knowing about cancer, how common it is, what causes this, how we can help protect ourselves, how can we take advantage of the medical knowledge and services available to you here in Newfoundland and Labrador, and also if you are diagnosed with cancer, what are the support and services available to you. So exchanging knowledge about all of these, also including the lived experiences of cancer patients and families. This is, I think, going to be very impactful, and it's already, I think, is impacting some of us, because I follow our, this is our conversation videos with a public poll, and oftentimes, you know, the participants are able to actually guess the right answer. So this is really amazing. One person at a time, one day at a time, one recording at a time, one piece of knowledge at a time, and one public poll. And this is our conversation series at a time. We are going to learn from each other. We are going to learn about cancer, and we are going to hopefully take steps to reduce our risk of developing this disease. And if we ever develop this disease, then we'll know better, hopefully, what to do, where to go, how to get the information, and what services you can have access here in Newfoundland and Labrador. So one day at a time, one person at a time. Thank you for listening to me. I always look forward to your comments. You can reach me at savas@man.ca. Our phone number is 709-864-6507. I'm also quite active on Twitter. And before I close up, I want to also say a regular reminder that none of these recordings or information I share with you today are supposed to be medical advice. The only medical advice can be obtained from your medical team or healthcare team or provider. So please consult them about your risk, what you can do, and how you can help yourself and others. But if you have any feedback to what I'm trying to do here with this program, this is our conversation series and other activities, please feel free to contact me. All the best. Thank you so much.